We conducted this project really because we know that rural patients have worse outcomes with cancer, likely due to a number of socioeconomic factors and access to care issues. And one of the initiatives that we've done here at Cleveland Clinic in particular is focusing on reducing time to treatment and looking at whether that affects outcomes. And our data has shown that improving time to treatment does significantly improve survival, particularly in earlier stage cancers, including breast cancer. So we wanted to look at sort of a larger data set, like the National Cancer Database, to see if that same type of finding could be seen in a larger population. So we looked at the National Cancer Database, which included patients from 2004 to 2012 with early stage, so stages 1 to 3 breast cancer. And then we looked at, your typical socioeconomic factors like their demographics, education, income, and then where they got their care, to see if rural status correlated with worse outcomes, or maybe what of these factors related to better results. So what we found, I think the initial look of the breakdown between rural versus non-rural, so this included around 1.2 to 1.3 million patients. And what we found was that rural patients were less likely to get their care at academic centers. They were less likely to have private insurance. They had more government insurance. Median income was under $38,000 for 42% in the rural group versus 15% in the non-rural patients. Certainly lower income there. The percents that had not completed high school was 61%, or over 13% of that population. Was 61% in rural patients versus non-rural. The patients tended to be older as well. But what was interesting really was, despite all of these factors, we actually found two things. One was that time to treatment was better in the rural patients. So it was 3.72 weeks versus 4.35 weeks. So roughly a difference of 4 to 5 days. And rural status was actually associated with better outcomes, so improved overall survival. The hazard ratio was 0.92, so not very strong, but it was still statistically significant. And really, we found the only factor that correlated with a good outcome that was in favor of the rural patients was a shorter time to treatment. So rural patients had that shorter time to treatment by 4 or 5 days, and we did find, as in our prior work, that having time to treatment less than 4 weeks, or even in the 4 to 8 week window compared to 8 weeks, both of those windows were better in terms of overall survival. They improved survival about 15 to 20% actually. So I think, the main takeaway to me of this is that I think we need to look more at initiatives to work on improving time to treatment, because it does seem like from this data set, which includes a large number of patients, that if we can work on shortening and reducing time to treatment, we can actually overcome some of the socioeconomic and access to care barriers that usually affect rural patients.